incredible activists this evening. My name is Courtney Bowder. My pronouns are he, him, his. I'm the director of the Social Justice Minor Program here at UW-Oshkosh and the advisor for the Social Justice Club. Tonight's event is a rescheduled keynote for the 2021 Social Justice Week, which is sponsored by the Social Justice Minor Program and the Social Justice Club, respectively, at UW-Oshkosh. And we had tremendous support from various organizations and departments. Special thanks to the Women's Center and especially Dr. Johnson and Eliza Farrell for helping coordinate this event. The 2021 theme for Social Justice Week was setting our sights on social justice. And obviously a conversation on health equity is both timely and urgent. Tonight, we're honored to welcome Dr. Patrice Harris, a renowned child and adolescent psychiatrist from Atlanta. Dr. Harris was the president of the American Medical Association and the first African-American woman to hold this position. A private practicing physician, public health administrator, and patient advocate, Dr. Harris has been an active leader in organized medicine for her entire career. She has served on the American Medical Association's Board of Trustees since 2011, including a term as chair, and has been the chair of the AMA Opioid Task Force since its inception in 2014. Beyond AMA, Dr. Harris has held positions of leadership with the American Psychiatric Association, Georgia Psychiatric Physicians Association, Medical Association of Georgia, and the Big Cities Health Coalition. A fellow of the American Psychiatric Association, Dr. Harris continues in private practice and consults with both public and private organizations on service delivery and emerging trends in healthcare. She is an adjunct assistant professor in the Emory Department of Psychiatry and Behavioral Sciences and an adjunct clinical assistant professor in psychiatry and behavioral sciences at Morehouse School of Medicine. It is my honor to now turn the virtual mic over to Dr. Harris. Thank you so much for joining us this evening.
Well, thank you so much for having me, and I'm so glad we were able to reschedule from the last time. You know, it's tricky. I tell you, whenever I'm in Central Time, I have to sort of do a double take and figure out if I'm in Central and Eastern. And so we had that mix up the last time. But again, I'm so honored to be back with you tonight. I do understand, though, tonight I have competition, but that competition is from a fellow Metro Atlantan from the ATL. So I will not be upset, or I am not upset for the folks that are attending the concert at BOB. And as I said, if I were there, I'd be there with you. So again, I appreciate all of you listening in tonight. I have a presentation. I'm going to go through that presentation relatively quickly just to whet your appetite with some issues and lessons learned from my journey. And then I really hope to have a lively discussion. So again, thank you so much for the opportunity. As I talk tonight about leadership, and first of all, I want everyone to know that leadership happens every day, and each of you, I imagine, is a leader within your own sphere of influence. Sometimes we think about leadership in large areas, leadership on a grand scale, and absolutely, I had the wonderful pleasure to be president of the American Medical Association during the beginnings of this COVID-19 pandemic, and had the platform of that wonderful organization to talk about a whole host of issues during this very trying time in our nation's history. But every day there are opportunities to lead, and I'll share a little bit about that tonight and hope to stimulate some discussion about leadership, because it is needed now more than ever. We are in a time of crisis, no question. We are in a time of transition. You know, people often ask me, Dr. Harris, will we ever get back to normal? And my answer is, I hope not, because there were so many things about the pre-COVID normal that were not okay. And COVID-19 has certainly amplified a lot of those issues. And so the question is, what will we do going forward so that we do not go back to the pre-COVID normal? And I like to talk about where we need to go, and the fact that where we need to go is a transformed normal. So I love to hear your thoughts on that, and I hope we all go together to that transformed normal. Next slide. So you heard about me, but the purpose of this slide, and I leave it in presentations even when I've had a wonderful and generous introduction, because what I want each of you to do tonight is to put your face where my face was. Yes, this was a photo that was taken the night I was inaugurated as president of the American Medical Association, but I want each of you to take a moment and think about you. This has been a tough year, and we all need to think about self-care. You know, many of us put others before we put the care of others or taking care of others, whether that's formally, certainly as a health professional, I am, or whether that's informally. So often people care about other family members and everyone else except themselves. So my request tonight is that each of you practice self-care every day. And it is not being selfish. And it is also, by the way, okay to not be okay. Again, it's been a difficult time with the pandemic, but with racial injustice, with our very divisive political season, with our threat, our attack on democracy. And there are many days that I have not been okay. And I think we need to make sure that we make routine self-care, but also make routine. It's okay not to be okay. And during those times, you count on your normal coping skills, but you also should know that it's always okay to seek help when you need it. Next slide. So, leadership lessons that I have learned on my journey are on this slide. Certainly, the importance of teamwork. Really, on any measure, on any matter, teamwork is important. It is too heavy a burden to carry issues alone. It's oftentimes impossible to do things alone. And so teamwork is very critical. And of course, that is critical in my profession, in the medical profession, but I would imagine that it's critical no matter what you choose to do. Your study, you know, I'm sure you have study partners, so teamwork is critical. Partnerships and allies are also critical as we work and as we sort of look toward this transformed normal of changing things, changing issues around racial injustices, health injustices, educational injustices. By the way, let me just say thank you to each one of you. I know you all are experiencing and learning virtually, that there's no playbook. And so I just want to thank you for your perseverance and actually you know, those who are not here and attending the concert tonight, that's also a measure of self-care and rewarding yourself for the journey of getting through this school year. It's also important to have a broad perspective. You know, it is normal or natural. We all have our own groups, our social groups, folks that we are very connected to, our posse, as I say from time to time. But it's also important to learn from others. No one has the market cornered on knowledge, no one generation, no one race or ethnicity, no one gender. And so it's important, I believe, to at least be open to learning to those who I say don't look like you, live near you, or think like you. So always be about the business of having a broad perspective and be curious and open to learning from others. Leaders do have a vision for the future, and as I talk to you about that transformed normal, we have to think about that. What is our vision for the future? How do we articulate the change that we want to see? And so that's what leaders do in ways big and small. Advocacy is important. I have spent my life working to change things that I saw needed to be changed. Now, listen, you can either change from within or change externally, right? There's no wrong answer to that. I have chosen to change from within because certainly, speaking just from the medical profession, and there's a lot that needed to be changed. And I have chosen to change from within and to advocate for the change that I needed, which is why, again, for various reasons, I've been very active on the state and local and federal level. But whether you're advocating for change at your university and you're advocating to the president of the university, or whether you're advocating for change in laws, please, I encourage each one of you to be engaged and really be committed. And if you see a problem, get in and change that problem. Be active in that change. And always stand in your authentic voice. And by the way, let me just be clear, I'm old. And all of these lessons I, of course, did not learn or did not know at the beginning of my journey. And my journey is full of detours and successes and setbacks. And so, and early on, and all of us, and you all are much younger than I am, you are sort of searching and solidifying your own voice. But I will tell you, once you find it, once you find who you are, what you believe in, once you solidify that, always stand in that authentic voice. Sometimes that means speaking truth to power, and that is absolutely okay. But be who you are. Early on, I remember I had a couple of mentors, a couple of folks who were a year or two ahead of me as child psychiatrists, and I felt like I needed to be exactly like them. But what I ultimately learned is I can take the pieces of them that I like and their characteristics, but I had to integrate that into who I was, who Patrice Harris was. And so always stand in your authentic voice. And I have to tell you that through the last several years, and particularly this last year, this is so much more important than ever. And I am always honest, and I'm more impatient than I was a year ago for change. And I always stand in my authentic voice, and I encourage you to do the same. Next slide. And so again, as we think about all of these issues and racism, and I'm going to speak from the perspective of health because that is my area, but I want you to know that all of these lessons and issues and concepts transfer to your particular fields. But clearly COVID-19 has elevated issues around structural racism, issues around trauma, issues around access to healthcare and education. We went into this virtual learning environment, but there were some folks who didn't have access to broadband. Perhaps there was only one person in the family with a laptop. And we also saw those who were most impacted by COVID-19 or those essential workers who didn't have the privilege, as I did, of working from home. And so as we think about all these issues, and I have a great slide that it is really all of these things, and they all are related to health. And we can talk about this afterwards, but some of you may say, what does any of that have to do with what I'm doing? Let's talk about that at the end. Next slide. So again, what creates health? I love this slide, and I bet you that any of you could find what you are majoring in, what area of study you have chosen in this slide, because the key point here is we are so interconnected. Our systems are interconnected. Health is so interconnected with policy, with whether or not you have a good job, with whether or not you live in a food desert, with whether or not you have equitable access to transportation to get you where you need to get to, whether that's your employment, whether or not that's your school, whether or not that's a grocery store. So all of these issues, and again, that is in policy, in laws. We know that past discriminatory housing laws led to folks not being able to, led to property values decreasing in certain communities. And how do we fund education? Through property taxes. some of you may know that as we built the interstate highway system in this country, sometimes we built those interstate highways straight through Black communities, communities of color. And what did that do? It disrupted those communities, but also meant that those folks who still lived in those communities were surrounded by exhaust and poor air quality, which leads to poor health outcomes. I talk about asthma here in Atlanta. And here's a fact. The Olympics, I had the wonderful privilege of being in Atlanta when the Olympics were here in 1996. And they, of course, encouraged us not to get in our cars. In the South, we are in love in our cars, and we did not. And during that time, during those 2 weeks of the Olympics, emergency department visits decreased significantly related to asthma. So certainly health and the environment, but almost any field of study that you are in can be tied, is interconnected with all of these issues. Next slide. And so another way of looking at that and understanding all of these issues of social justice issues is you have to look at upstream determinants of whatever the issue is, midstream and downstream. And it's important. And as we go upstream, again, I look at this through the lens of health, but we look at policies and laws and whether neighborhoods are safe and policing and structural racism. And so all of these issues are critical. And if we want to make change, leadership is needed to change policies and actions and determinants at all three of these levels. Next slide. And finally, this is my last sort of slide around the upstream, downstream, midstream determinants. But I love this slide because it really just gets to the bottom line. Healthcare, education, transportation, law, whatever, we need to meet people where they are. We need to make it easy for folks to navigate whatever system they need to navigate, the health system, the justice system, our school system, employment, housing. We need to make sure that we take the burden away from the individual and onto the system. And we certainly need to center equity. That's why you see many of you probably seen that cartoon in the center there. You've probably heard people say, well, you know what? I just treat everyone the same. That's what we need. That is actually not equity. Equity means that each one of us gets the support and the resources that we need. As you can see, the adult there doesn't need any help to be able to see over the fence, but the littlest kid needs 2 boxes. And so we should be able to talk about meeting people where they are, getting them what they need so that everyone has equitable opportunities to live a healthy, educated life. We need to make sure that we are looking at laws and policies and center individuals and families. Next slide. Another key issue that we need to make sure we focus on is trauma. And the importance of understanding the impact of adverse experiences in childhood. By the way, you adults still experience trauma, but clearly this landmark research from CDC and Kaiser demonstrated that early adversity has lasting impacts, and not just psychological impacts and impacts on our emotional and mental health, but also issues regarding chronic disease, cancer, and diabetes. So I am a child psychiatrist, and you would probably guess that I'm particularly keen to have these conversations. But I think trauma, and again, the racial trauma, the trauma from seeing the George Floyd murder was just traumatic for many folks, and even more traumatic for those from communities of color witnessing that. And I had so many of my physician friends, my physician mom friends, I don't have children, who just couldn't watch it because it's just too hard and worrying about their own children. Next slide. And as we think about inequities and disparities around children, we also have to think about mental health. And I hope that, and I know that we have made some progress regarding stigma and people being more willing to talk about their mental health. There I'm not sure, I haven't checked it lately, but there was a website, Hip Hop Mental Health. And so we have so many entertainers and other influences, professional athletes. And I think that's a bit important for folks to say, hey, I'm struggling. Does not mean that I am weak or I have a character flaw. I'm struggling. Of course, I am particularly keen to address these issues in children and young adults. Being a child and adolescent psychiatrist, we need to normalize talking about mental health. But of course, again, when we look at disparities, we know that children from communities of color have less access, more likely to receive less culturally responsive care. And unfortunately, we've seen an increase in suicide and suicide attempts in young folks in general, but particularly around young Black men. Next slide, young Black adolescents and men. And so, again, just with the focus on children, we know that COVID-19 has impacted everyone across the age spectrum. And this is something that I am keen to continue to work on as I make sure we have a transformed normal going forward. Next slide. And I think I've made this point about the mental health inequities that, by the way, I'm sure you all know this, existed pre-COVID. Health inequities existed pre-COVID. Mental health inequities in particular existed pre-COVID, not new. But what COVID has done is really amplified these issues. And I like to say that we're all very busy. You all are in school. I'm working, all of us, and we have a lot of distractions. And then we have the fun distractions. We have concerts. We have our day-to-day activities. But during COVID, candidly, all of those were gone. And so I believe one of the reasons these issues have come to such focus is that we didn't have the opportunity to look away. And actually, I would not have wished COVID-19 on our world, but that has been one positive consequence, if you will, of COVID, is that we've had to look at with unvarnished truth many of these issues. Next slide. And so what do we do, right? Because again, we know these issues exist, but it's not enough to know. We have to do something about them. Next slide. And so one of the things is naming them. And again, this is just an example. And I know a lot of schools and organizations are making statements about these issues. And that's important. That's the first step. We did that at the AMA. I've seen so many organizations, corporations make a statement. But again, what leaders do and what we will all have to do going forward in that transform normal is hold people to account on actions. These statements can't be performative, right? It can't be declarative advocacy. It has to be real advocacy. And that has to be backed up by action. Next slide. And so again, as an example of that action, this is something that we did at the AMA. I think there's a little bit of issue with this slide, but AMA, again, at the year that I was president, we made a statement that police brutality is a matter of public health. And I remember I was doing an interview with a reporter, and they were saying, why is the AMA speaking out on police brutality? And we said, because there is a direct link to the health of the public. And so again, this is just an example. So the key issue is whatever organization you belong to, are they willing to speak up about these issues and make the connection to whatever profession? We made the connection to public health, and that's critical. Next slide. And again, we backed up those statements subsequently 6 months later with policy. And then that policy, of course, is used for advocacy. So you can see all those lessons learned that I put on the first slide is important. moving forward. And how do we at the AMA use our policy? You saw that a slide about what impacts, policy impacts, laws impact. And so policy is important. Next slide. We also backed up that work with creating an institution. And again, this is just one example, but creating institutions that are committed to the work is important. Next slide. And certainly as we think about health, we also have to think about the advocacy piece and make sure that laws to protect health, again, in my profession, are on the books, that policies are on the books. And these are just a few that the AMA has put forth to protect access to health care. But this, again, would be analogous to any discipline. You have to keep up the work, right? It's not a one and done kind of thing. You know, we supported, again, and as an example, the Affordable Care Act, but we've seen an assault on that. We've seen an assault on democracy. And so it's not just a one-time thing. You have to be committed as leaders to the long haul and the work over the lifetime of the problem. Next slide. And then, as we saw and we've seen in democracy, things that maybe we took for granted, we cannot take for granted. It requires constant care and feeding. I've already talked about the importance of mental health, so we can go on to the next slide. And again, one of the things, and I'm so glad to see many of you here. And so as you look in your own profession, whatever field of study, look at who the workforce, look at who is around the table, look at the diversity of your workforce, whether it's law or social work or medicine or nursing, or being a plumber. Again, it's important to make sure that you see diversity represented across the spectrum of your own field of study and profession. Next slide. Again, and then look at what you are doing and what your institution is doing, or what your club is doing, or your organization is doing. If you don't see yourself being part of a profession, area of study, university that is diverse, then the question is, what are you going to do to make sure that that happens? And these are just a few of the actions of the AMA, again, but this is not about the AMA. This is about stimulus for work that has to be done to increase diversity in whatever your field of study is. Next slide. And so again, it's from the beginning. You all have made it again to college. We have to make sure that folks coming behind us make it to college, and that we have to make sure they make it to high school. We have to make sure they make it to elementary school, and not only make it there, but are successful there. And that's work that I have been committed to do in all of my interactions and continue to do in the STEM fields. You know, one of the most important moments of my being in leadership was so many folks said, you know, Dr. Harris, because of you, I could see myself as a leader. I could see myself as an engineer. I could see myself in the STEM fields. And so that's what I want to continue to do. And all of you, again, whatever your profession, please, you are visible representation that, yes, you can succeed. And so I want you to continue to do that. Now, when I talk to younger students, I also say, now you do what you can. You work as hard as you can. But it's also important, remember, going back to that system slide, that those of us, and I consider myself in a position of privilege, make sure that everyone has an equitable opportunity to succeed. Because it is not true. Now, we maybe you've heard, or I heard, you can grow up to be anything you want to be. Well, no, that's not true unless, you know, folks are working to smooth the path and make sure that the playing field is equitable. And so we do that regarding physicians. But again, this is important no matter what your field or profession is. Next slide. Next slide. I think we will keep going through these slides because I want to get to the end. Certainly vaccine adoption and really just any solution is important. And why is it important for me, or why did I leave this slide in? Because it was difficult, and it still is difficult. There are certain populations, and that has been ebbing and flowing as the COVID-19 pandemic has gone on. But it's important to be a trusted source of credible information. So whether it's vaccine adoption or anything that you believe that will benefit a community, it's important to be a credible source. There is so much misinformation is out there, and you all know that on social media. You can type in anything, and unfortunately, and I know you all know this, it's not all true. It's not all credible. And that's why, as a leader, you should always endeavor to be that credible source of information. Next slide. Of course, that has gone a long way, been part of this campaign. We've had churches involved. I've had churches involved in mental health care. I talked with the Congressional Black Caucus Legislative Weekend. We had a whole session on mental health in the church, because we know that for some faith community, but for some it's others. So it's just about being a trusted source of credible information. Next slide. Next slide. So again, this is what we say all the time, and I said this early on. If you want to change the system, it requires your support and your involvement and engagement. Now, you may fight external to the system or internal to the system, your choice, but please stay engaged. Next slide. And so I had the opportunity, again, as you know, to be president, and my end of my term, we give sort of the end of term presidential address. And I talked about King T'Challa. And again, we are in a time of crises, and we've been in times of crises before, and we will again. It will be a different crisis. But I do believe that and I believe, as King T'Challa tells us, that in times of crisis, the wise build bridges while the foolish build barriers. Next slide. And so I'll end with this. I don't know about you, but I was inspired on Inauguration Day by Amanda Gorman. Because, I've laid out a lot of issues, a lot of issues that we didn't talk about tonight. I talked about the transform normal, and all of the things that are on our to-do list to make sure we get to that transform normal. New laws. We need to have appropriate and reform of policing. It breaks my heart, and it's unacceptable to see those with mental disorders killed, because of a police encounter. So again, a lot on our to-do list, although I do want you all to make sure that you continue you don't have to do everything at once. Just do your work and get your degree, and then there's opportunity to change. Although by the fact that you are here tonight and you're already in this community of social justice, you're already working towards this. So the work is hard, and the work is long. We have to play the long game. And I hope that it's not always easy. I know it's not always easy, and it can sometimes be overwhelming. But when I get overwhelmed, I remember what Amanda Gorman said on Inauguration Day. And she said, so why once we asked, how could we possibly prevail over catastrophe? Now we assert, and she inspired me to say, how could catastrophe possibly prevail over us? So I choose to be inspired and to live every day and to keep Amanda Gorman's words in mind. So thank you very much for your time this evening, and I look forward to the conversation.
That's wonderful. Thank you so much, Dr. Harris. We're going to move into a Q&A portion of the event. So what we can do to facilitate this is instead of turning people's video on and trying to minimize external sounds, we'll just have people share questions in the chat area that you have for Dr. Harris, and I'll facilitate that, and then we can listen in to how she responds. So go ahead with some of those questions. We're getting some thank yous, of course.
My pleasure.
I'm thinking about these terms, new, transform, normal, and some of your quotes. You do what you can, but also challenge systems that are inequitable, and how important it is for us to be trusted sources of credible information. So looking for folks to share questions in the chat area for us to have some good dialogue. What do we have out there, folks?
Don't be shy.
Yeah, there's always a little bit of a delay. We're getting them now. So I'm not sure if you're able to see them, but I'll read them for the good of the group because not everybody can see them. But Dr. Johnson says, sometimes students and non-students feel overwhelmed learning about all the injustices that exist. What advice would you give to folks starting out at the beginning of their journey? Where do they begin?
So I think the first thing is to recognize when you get overwhelmed, right? Because there's no question, we can't sugarcoat that there are a lot of injustices, right? And we can't pretend that there are not a lot of injustices, and we can't pretend that, you know, our democracy was threatened. The very fiber of our country and who we are was threatened. So the key is to realize that and say, what can I do? And that you don't have to solve all of the problems. And by the way, these problems were not created in a day. If you're thinking about structural racism and some of these issues, they were been here for 400 years. And so we have to make sure that we are attacking them in the ways that we can. And I would say, so just pick one thing. Pick one thing. Each person pick one thing that they are very passionate about and they want to change and focus on that one thing. Can I do it all? And then those other leadership lessons that I learned, find your partners, find your allies, find your team. Again, know that you cannot do it alone, but and when you get overwhelmed, that support system, you know, make sure you have that support system and use that support system.
Thanks so much. Jared said, so inspiring, exclamation mark. You mentioned those with mental health being killed by law enforcement. Is that a common thing? I haven't heard much about that.
Yeah, you know, and I don't have the stat in front of me, but you know, we've seen stories, and then these are the stories that get reported, right, of you know, folks who may have a severe you know, mental illness, and you know, sometimes that may be schizophrenia or bipolar, and they may, you know, be acting erratically, and someone may call the police, and then the police response, you know, not fully appreciating. Now, I do say, and I note that I was a part of this too. You know, there have been lots of efforts to train police, and some of those have been great and successful. But I do think we need to rethink. And you've seen some cities say, okay, when it's a call about someone with a mental disorder, they are first going to send out EMS and a social worker rather than the police. So unfortunately, there have been instances of folks who were, you know, had a mental disorder and look, and may, of course, not be, if they're hallucinating or delusional, they may not be able to appropriately respond to a police command, right? And so, and again, you know, many police jurisdictions have been trained on this, but still, we should relook at who responds to these issues. And almost analogous, you know, there's some talk of, and this is the conversation that we need to have, that maybe armed police should not be the first responders at a traffic stop, right? If you have a tail light, you know, who do you need to respond? So it should be the response should meet the need. But yes, unfortunately, there are cases where folks with mental illness, again, the impact, you know, the encounter with the police, and unfortunately, there have been some who have been killed.
Thank you for that. Ashton said, you talked briefly about overcoming any obstacles that have come across your path. How would you recommend to us as college students can maintain hope and strength with breaking down the barriers of race, sexism, all other injustices, as they very much are still around, as they are very much still around?
So here's where you call on your support system. I can tell you on the days that I feel overwhelmed, I call my friends. I call my girlfriends. I call my cousin who's more like my sister. If it's an issue in medicine, I might call my some other physician colleagues, and how are we going to address this? And you know what? I admit sometimes I'll text and I will say, I am exhausted today. Or if it's someone who said something racist, I would say this person is, and can you respond because I am just too tired. So I think it's about maintaining those connections, getting a group together, getting your allies together. And also, I talk sometimes about having a personal board of directors, because sometimes you want to make sure that your thinking is correct on an issue. Sometimes I will do this. Someone will say something, and listen, there are some extremes where it's racist or sexist or homophobic. But there might be something, and say, oh, okay, what am I being too sensitive? And I have to say, though, I do worry about this a little less, but you do want to make sure, and you want to be strategic. By the way, I urge all of you as young students, and you want to, and this is why you want allies and folks who have more privilege, because, I was just on a webinar the other evening with an attorney, and he said, sometimes people forget about the consequences. We talk about the civil rights movement and, Reverend Martin Luther King and all of those. What we don't always, and of course progress, but what we don't always talk about are the consequences, right? There were consequences. So there are, and even as I said, stand in your authentic voice and speak truth to power. There are, some consequences. So this is where you need your allies. As students, you want to think, right? You want to be strategic. You don't want to jeopardize your career, right? You so want to make sure you think through the consequences of, if I speak up at this point, to this person in this situation, how will that, impact me? And you could get advice from others. Now, I will tell you that I do that a lot. I say, if I say this in this moment or speak up, how will this impact me? And the answer might be, it will negatively impact me. But at times, and again, I have privilege now, I will make a decision to say what needs to be said, even if there might be a negative consequence. But here's where you again use folks who are in positions of power, because I do know that I have the privilege. I'm a physician. I'm old. I've been past president. So I am in rooms. I'm in rooms where I may be the only African American, the only African American woman, the only woman. And there are times that I have to speak when someone says something or they're not raising an issue correctly. I have to say it. Now, I get to say that because privilege. So, but I do think through that, and I say be strategic, think through consequences. Sometimes it may be, all right, Patrice, you say that because I can't say that, but you can say it. So those are things. It's getting your posse together, your partners and your allies.
Thank you. Ashley asks, what advice do you have for those who find themselves challenged and confronted by ignorance? There's lots of that going on around
yes.
right now.
And you saw me. So first you take a deep breath, right? And and it depends, right? Is someone willfully ignorant, I guess, or is someone truly not been exposed? Although I will have to tell you that the leeway I gave 2 years ago, I don't give today, right? Because unless you're living under a rock, there are things that you should know. And so, but see, if it's willfully ignorant of folks who need to be educated. And then if they are, and you believe that it is worthy of your time, let me say this, and you make these decisions. I have decided that there are some people who may be willfully ignorant and are not interested in learning or changing. I decide that they are not worth my time and energy. Right. They can continue on and be willfully ignorant, but I am not going to give them any of my energy. Right. And so sometimes you make those decisions. But for those who are sincerely willing to learn, now here's one thing I require. And you might say this, listen, I'm happy to talk to you about these issues. but you must come to this conversation with some knowledge, right? Because oftentimes it's the folks who are most impacted that have the responsibility and the burden of explaining. And I no longer do that. So I will say, you can read Caste by Isabel Wilkerson. I'm looking over at my library here. Read How to Be an Anti-Racist. And you can pick your two things. You said, go back and read these two things. And when you read these two things, these two books, come back and we'll have a conversation. Say, I'm happy to have a conversation with you, but I require that you come with some knowledge. That's how you demonstrate that people are interested. And if people say, well, I'm not going to read the book, and I would say, well, you know what? Not for you. I'm not the one.
Thanks for being honest about that.
Yep, very honest, very authentic. Yes,
absolutely. Absolutely. Lily asks, or says, I work at a mental hospital where everyone admitted was brought in from a police encounter, and it's amazing how after medication and therapy, these people change. So more of a comment. I don't know if you want to elaborate on it. And responding to one of the prior comments about the lack of awareness around some of the issues associated with Ashton's question and some of the comments earlier. Another question.
Mental illnesses are biological illnesses, right? They're a disease of the brain. Just like if you have diabetes, it's a disease, your pancreas is not working correctly. If you have a heart disease, your heart is not working correctly. So these are brain disorders, and with treatment, and these are not curable, just like high blood pressure is not curable, it's treatable, but not curable, unless there's a specific cause. Most hypertension, most high blood pressure, there's no specific cause. But it's treatable, right, with medications, with diet and exercise. And so mental disorders are brain disorders. They're chronic, again, treatable. Now here's the issue. As I pointed out in my talk, unfortunately, not everyone has equitable access to mental health treatment. For many years, this is just a little bit of a nuance regarding mental health treatment. Insurers didn't pay for mental health treatment in the same way they paid for treatment of your diabetes, your med surge issues. Now, George W. Bush signed parity into law when he was president, and with the Affordable Care Act, that made mental health care an essential benefit, right? Meaning that it had to be covered. That's just recent. So many folks are now able and have been able to get treatment with Medicaid expansion, and because under the Affordable Care Act, mental health care for your mental illnesses, mental disorders, substance use disorders had to be covered. So yes, these are brain disorders and they are treatable, not curable.
Thank you.
But just like people sometimes make decisions, do I pay for my insulin or pay my mortgage? Right? Do I pay for insulin? And so we need to make sure, again, that's why it's important that everyone have access to affordable, meaningful health insurance.
I won't ask you to offer a comparison of what you've observed in other countries around the world in terms of access to healthcare, because we know systems are really different. But it's kind of, I've had students do some comparative research on that, just in terms of, maternal healthcare, paternal healthcare, leaves, all kinds of things associated with how care is provided or denied in different parts of the world.
And let me say a little bit about that, because one of the privileges I've had of being a president of the American Medical Association is we get to represent the AMA at World Medical Association meetings. So I have been to Canada, I have been to the UK, and I have talked to physicians all over the world. And so I'm very glad your students did the work, and you said something critical there. You said in other countries, they pay for leave, right? And other things. So other things that we don't think is traditional care. So I do think that, and by the way, none of those systems are perfect. I think we know that. There are always trade-offs. And in this country, we have to be willing, and we have these conversations from time to time, although unfortunately they're politically charged. But we have to decide in this country, as a country, I wish 300 million or however many adults who are voting age. I wish they voted, but that's how you have conversations about what we want in this country. And I believe we'll have to find our uniquely American system. You know, there are long wait times, and I'm not bashing any in other countries that in this country I'm not sure we would accept. So what are the trade-offs? That's a part of an informed debate. I talked about people coming to the debate or a discussion about health inequities or racial injustices. You also have to come to the debate about healthcare informed, right? Not just an opinion and, oh, we should just be Canada or the UK. And your students have done that work and also noted that in addition to what they spend on healthcare, they may spend more on childcare, and they may spend more on those other issues that, as you saw in that slide, are determinants of health, but not traditional health care.
Thank you. Ashley has another question. What resources do you find yourself turning to when you want more information on something that has a lot, that there is a lot of misinformation on? Do you have any recommended sources that might help people be able to feel they can lean into it for the credible information that you?
We're certainly on healthcare, but I think she's asking about any other issues. And so here's what I would say: use your critical yes, and the confirmation bias, right? And that is where you try not to you make sure that you engage in informed conversations. Now, I don't believe that you have to engage in conversations with people who are mean-spirited and are, you know, racist and homophobic and sexist just cause, right? There's some people who are bombastic and they do that. But if someone has a different opinion, say, you know what, I don't agree with that, but I want to understand at least where you're coming from. And that's it's always a good idea to get out of your bubble, because all of us have those bubbles. You know, all of us have those bubbles. So get out of the bubble and make sure you're talking to folks, like I said, who don't think like you know, look like you, or live near you. And the other thing is, I would use your very well honed critical thinking skills. So when you see something, because listen, I Google something all the time, right? When it's healthcare, I know I have the knowledge, but maybe about something else, I don't have the knowledge. But here's what I always dig beneath the headlines, right? So when you see something, say, okay, where is this from? Who is this person? And then you might have to look, okay, is this person a scholar? Or is this person, you know, someone who is just, you know, bombastic? And so here's where you need to use your critical thinking skills, which I think is one of the most important things a university can teach. Not necessarily the facts. Yes, we all need to learn about our specific profession and area of study, but the most important thing, I think, is critical thinking skills, because those skills will give you what you need to cut through candidly the mess, the misinformation, and the disinformation. And so if you know how to critically think, that helps you evaluate what you see and read and know what's misinformation, what's credible.
Thank you so much. Any other closing questions coming in right now from anyone? You're getting a thank you from Ashley.
Welcome.
Yeah, these are difficult times to sort through a lot of the mess, as you said, and everybody needs a little way to navigate through that. Ashton's also saying thank you. Any closing questions as our time comes to an end? We want to be respectful of your time in the ATL.
Well, everyone get to that B.O.B. concert and tell me how it was.
My daughter is in the other room in a Girl Scout meeting with Michelle Obama right now. And
oh,
here
wow.
we are with the opportunity to meet with you. We are grateful for your time tonight. Very, very happy that we were able to reschedule, and you're getting lots of thank you. We hope to use this presentation for a little while as a resource. Unfortunately, some of the folks in our administrative capacity of College of Nursing weren't able to join us, but we'll be sure to pass it on to them, and we're grateful for your work and your message. and your time with us tonight. So thank you.
Very good. And I'll just say about Michelle Obama, you know, I was so glad when she said, you know, that she had been struggling with being depressed with all that was going on, because we really need to just normalize discussions around mental health. So I'm glad your daughter is having that opportunity. Thank you so much for having me, and thank you so much since we had to reschedule. And I wish everyone the absolute best. Stay safe, stay well, take care of yourself.
Thank you.